You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoy the podcast, please listen, subscribe, like, and share it with friends. Thank you. Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. I have Dr. Amelia Mazgaloff. She's a chiropractor and a pretty good one, top-rated San Francisco chiropractor. I'm not sure if listeners know much about chiropractic, so we're going to go into what it is, how it works, and why it possibly can help people with certain health conditions they have. So, Dr. Mazgaloff, thanks for coming. How are you doing?
Very well. Thank you, Richard. I'm so glad that you reached out to us. And I would be delighted to tell people what chiropractic is. Chiropractic is the science and the art of using your hands to help people heal their nervous system, starting at the spine, going through from inward out, from the spine out to the extremities and up to the head and down to the feet. We use our hands and we feel for any kind of subluxations or misalignments in the spine. And as a matter of fact, in any joint. So it doesn't have to be only spine-related injuries. We treat spine, we treat headaches, we treat menstrual cramps, we treat anything from tennis elbow, feet. I have people that come to see me for finger issues. So chiropractic could be used on any joint. And as a matter of fact, This is one of the best ways to treat any kind of joint disease to relieve pain and inflammation.
So what is a subluxation and why did it happen?
Well, subluxation is a fancy name of misalignment in a joint. It could happen from everyday stresses. The nature of subluxation could be physical. Obviously, if somebody runs into us, or we are in the field playing sports, we can trip or falls, injuries like that. Can cause joint, which is pretty much a unit of two bones and that are surrounded by ligaments and tendons and muscles. So with trauma, those could be strained and stretched, and that joint also can misalign in a way that it cannot really realign itself. So that's where chiropractors come in and help relieve that, meaning that we are helping the body get the joint back to normal position, normal function, and that should involve, and most chiropractors use muscle techniques. We use adjustments for the tendons and the ligaments, and of course adjusting the joint so that we can tell the body and the brain to kind of get it back to neutral and fully functioning position.
So to the outside observer, you'll be, for instance, pushing down on someone's back, and they may hear some popping sounds where they crack. Like what is a crack?
Yes,
when you adjust someone, what happens?
That is a very good question. I get it all the time from my patients, and some of my patients love the crack, and some other patients I don't ever want to hear my bones cracking. And what the crack is when the joint is not functioning properly, whether because of an injury of the joint itself or the tissues around the joint. Mobility is always compromised, and with that compromised mobility, there's also inflammation, and inflammation is just a swelling. That swelling, imagine like a swollen ankle, decreases the range of motion further. And when there's no mobility, there's no diffusion of gases, of nutrients, and waste away and into the joint. So motion is what brings nutrients into the joint, and it also is what brings waste out of the joint. And if there's no diffusion like that, some gases like CO2 gas accumulates through there because there's lack of mobility. And then when we press on it in a certain direction with a certain force, we are able to hear this gas escaping, just like opening a Coke bottle, and the pressure escapes from the joint, and that decreases the pressure inside the joint. It also decreases pain, it decreases swelling, so we are able to restore that diffusion and motion in each and every joint through the adjustment.
Yeah, I'm one of those people that loves when it cracks, the more the better. But if it doesn't crack, I feel like I haven't gotten an adjustment, which I'm sure some patients say, but they are being adjusted still, right?
Yes, well, that is not the case. We have a specific techniques made specifically to adjust the joint without the cracking, with an addition of either an instrument or an addition of drop table. And the way those work is that we are able to decrease the pressure, but through increasing the sensibility of those mechanoreceptors, which are inside the joint. There are receptors that tell the brain that that joint is moving. So we really don't have to make a big, wide range of motion and a pop and a crack if we're using those this instrument adjusting technique or the table, because with that there's a very quick stretch of the joint capsule, so not enough to stretch it to the point where we hear a pop, but enough to stimulate the brain to say, "Hey, pay attention! This is what happened. This joint moved," and the body starts to reintroduce that motion back. So, and that motion then is what takes the diffusion and decreases the gas inside the joint as well. So it's just different techniques. They all work. In our office, we use manual techniques. So there is cracking or popping, or we use instrument or drop table. A lot of times we use blocks, and they all work. What's really important is to pick the technique or the combination of techniques that people are most comfortable with, or they really experience that relief.
Well, is it about what people like, or is it about what works best? I mean, do you use like the activator plus the drop table plus manual adjustments all in once? Or?
It's never. As doctors in our practice, we do take very thorough history. Many people that come to us have actually already been to a chiropractor. They've been to a physical therapist. They've been to a massage therapist. All kinds of other therapists, and they come here because something did not work for them, and usually it did not work for them is because the way treatment should be, and this is why I went to chiropractic school. It's not just simple, let's pop every single joint on the body or adjust every single joint of the body. It should be mostly, let's re-educate how those tissues, joints, muscles, tendons, ligaments, how are they going to support the joint in a new way so that this does not return. So that is the more important question. So as you were saying, we never go by what the person, they come to us and say, oh, this has worked, this hasn't worked. So it's good to know these things, but at the end of the day, as doctors, we are the ones that suggest the treatment plan, suggest what kind of adjustments they will need, and if they're absolutely terrified from popping, cracking, then we can certainly accommodate and use other techniques. But generally, patients that come in, they learn to trust us. We educate them. They understand exactly, which is really important. They understand what's wrong with them, how we're going to fix it, what are they're going to be doing, what we are going to be doing. We have everybody's on the same page, and we are a team working towards getting this done, so that they can never have this, neck pain, back pain, shoulder pain, whatever it is, come again. And that is what happens when you do the right thing. I have patients that I haven't seen for 12 years, and they come back with something different, and that is the goal. We need to actually work towards fixing the problem rather than just alleviating the problem.
So how often do your patients come? I mean, so they get adjusted. How long does it take for the subluxations to come back on average, and what happens then?
Well, it depends actually with the way our treatment plans are short in the beginning, but very intense, meaning that in order to re-educate how a joint function or a tightness in a muscle or ligament or tendon, you actually need repetition. It's just the body relearning what the new tension should be, what the new range of motion should be, and then obviously reinforcing it with some exercises. So our treatment plans are we see patients for 2 weeks, for about 3 times per week for those 2 weeks. So that is 6 visits, and within those 6 visits, they will experience pain relief mostly on the second or third visit, and of course it depends on severity. But by the 6th visit, for sure, our goal is for the pain to be 80 to 90% gone or completely gone. Our goal is for them to have restarted all the activities which they had to stop doing because of the pain and the subluxation and the inflammation, as well as get them on a therapeutic program that in the way we adjust them. So we teach our patients therapy exercise on every single visit, 1 or 2 exercises that pertain specifically to the way we adjust the joint, so that when they go home for that week, they continue the repetition and the re-education of that joint in the way it was adjusted, so that they actually never lose their adjustment. So in 2 weeks, we reevaluate, and then from there on, we start putting them mostly on maintenance. We see them for once a week for the next 4 weeks. During that time, we give them instruction of how to start getting back to whether running, whether CrossFit, or any sports that they were doing before, so that we can monitor as that they are progressing, that they are not getting the subluxation back. And in 4 weeks, they're done. After that, we do not require, or we don't make any patient come for or maintain, but most patients, 99% of our patients, feel the benefit of care. So they return for maintenance adjustment anything from 4 to 6 weeks. But some don't come at all until they have something. And as I said, we saw patients that I haven't seen in 12 years that came the other day with a new complaint. So it's really up to the person of what they do after.
So do your patients come back like once a week or once a month, or what's typical after the initial 4 to 6 weeks?
The typical maintenance schedule is anywhere from 4 to 6 weeks, and it really depends on prior history, on the intensity of the activities that people do. we're in the financial district of San Francisco. I see a lot of patients that sit on the desk, a lot of repetitive stress injuries, both at the desk at home and also at the gym. Our patients are, very stressed, very busy, but they are also very active. They want to relieve stress and feel good, and mostly a lot of weekend warriors that also go out there and injure themselves. So it depends on the activity level. We suggest anywhere from 4 to 6 weeks.
What would you say is new in chiropractic in the last couple of years? Are there any new treatment methods or other modalities that you're incorporating?
Yes, I love the fact we are one of the most modern, offices in San Francisco. I love using technology to help people both with treatment, but also understanding what they have. We have the really nice. Everybody loves those flexion distraction tables that they can move in a different direction and stretch out at a different angle. We can bend them laterally so that we can open one side of the body and work and really feel the mobility through each and every joint on that side and go the other way. We do also have impulse instrument, which is not quite, which is much more advanced than the activator. It is delivering a barrage of very fast impulses to the joint. So it really stimulates those mechanoreceptors that we talked about earlier, so that we're working more with the neurology now, not just muscles and bones, but really getting into the neurological aspect, because as we know, the nervous system is in the spine. Every level goes to specific body part and tissue and joints. So it's really important that we're able to engage a neurology. And when I explain it to people, it makes such a great sense to them. It's like, oh yeah, it's just like when I go to the gym and I work out for for a day, I'm not going to get biceps all of a sudden. I'm like, no, you're not going to. But if you go, maybe 3 times a week for the next 2 weeks, maybe you'll start seeing something, So it's definitely an awesome things that are happening with chiropractic. Lasers are another part that are pretty big. And we are going to be incorporating lasers very soon. Educationally, we have great on the iPad. We have really cool ways of people to see what is happening. We also have a video equipment that we can videotape them and see what the movement is, so that they can own that. Because if they can see and know what's wrong with them, they have all day 24/7 to be able to know what not to do and what to do to stay better. And that is, I think, most powerful about people knowing what they have so that they're empowered to change it.
Very good. So what's the best way for people to find out more about your clinic? And then after that, maybe to find out about chiropractic in general. But your clinic, you serve San Francisco area. So, is there a good website for them to go to, or how do they find you?
Absolutely, yes. Our website is ChiroHealth SF, like San Francisco.com. Of course, we are also on Yelp, and we are rated as one of the top 3 chiropractors in San Francisco. They can read lots of reviews on Google. Find us on Google at Chiro-Health, Inc. So it will be really easy to find us if you type ChiroHealth. We should be able to find us really easy.
Really good. Well, I appreciate you coming on the podcast. Thank you very much.
You're very welcome, Richard. Thank you for having me.
You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoy the podcast, please listen, subscribe, like, and share it with friends. Thank you.